What should providers know about the 36-month mark in regards to home oxygen?
So, well, for 36 months onwards, we need to make sure that we're still doing the maintenance and services. So, for tanks, we need to make sure that we are refilling them, but we can also bill the insurance for the content of the tanks. We can bill that
Absolutely.
after the
And
36
that's what,
months.
in order to bill for the oxygen contents, what do you have to have in a patient file or in the file typically? Let's go off Medicare criteria.
Right. Well, basically, we need to make sure that we have a delivery ticket on record. That's the number one requirement. We cannot bill both the concentrator. We can only bill the contents after the 36 months mark. And we need to have a prescription on file, of course. But the maintenance and
Now,
services.
for that prescription, I'm going to act dumb. So is the original prescription good, or do we need to get a new prescription every single year?
We need to make sure that we have a recertification for the prescription. So we have this so-called revise, and we also have another thing that's called recert. So every after a year, once the prescription is no longer valid, we request for recertification from the physician who ordered the oxygen for the patient.
Yeah, and that's good because you really need to also have that in the patient file because oxygen, it's actually not it's a drug is really what it is, which is why unlike let's say a wheelchair, you can buy a wheelchair privately without a prescription. You cannot buy oxygen without a prescription.
Correct.
It's a drug regulated by the FDA, so therefore you cannot just say, hey, my doctor said, or I need oxygen. No, you have to have a prescription to bill for oxygen.
That is correct. And even if they wanted to change the LPM or liters per minute for the oxygen, we want to make sure that there is a prescription on file prescribed by the doctor. If they want to go higher or lower, they cannot just change it. Although they have the ability